Good afternoon. My name is Vajuka. I do have Dr. Suad. Please, could you introduce yourself?
Thank you to have me here today with you. I'm Dr. Suad Sajwani. I'm a consultant with nephrologist and transplant nephrologist at the Emirates Health Services. I'm the chairperson for the transplant services at the Emirates Health Services, as well the conference vice president.
Could you basically tell us a little bit more about what the conference is about?
I mean, this is the second chapter of the conference, and it highlights the advances in critical care medicine and organ donation and transplantation. It's not only highlighting the advances, it's also showcasing where we reached at this time in UAE in terms of, critical care medicine and organ donation and transplantation, and how these two services were a little bit like, baby services a few years ago, and they just jumped to big steps. And now we are just competing with the best practices in the Gulf area.
Could you tell us a little bit about the services and basically the transplant program that you're running?
Yeah, as I said, that our programs are like, new programs. So my program, the transplant, started back in 2020. And we started with the kidney transplant. From that time until now, we've done 20 cases. Most of the cases are from the disease donation patients. As I said, it's a new program, but we are just aiming to be a high volume transplant center. Let me talk to you a little bit more about our future plans other than going to a high volume kidney transplant service. We are also aiming to start transplant in other organs like the liver and the heart.
If we jump into asking about the biggest challenges within the organ donation and transplantation today.
Let's speak first about the donation side. In terms of the donation side, the disease donation is relatively a new idea to the society here and generally in the Arab society. So the biggest challenge is how to convince people to proceed with donation. It's mainly the disease donation, because in fact the living donation people are willing from before, but the biggest challenge is regarding the disease donation, which is a new idea to the society. Some of the people, they don't have the right perception about this idea. So to educate all the population, and not only the population, let me be realistics. Even some of the physicians, the health care providers, they are not convinced about the disease donation. So this is another challenge. If you are not convinced, then how you will convince your society?
So when the healthcare professionals, how do they address these challenges? What's helping them help?
Well, through our Emirates Health Services and in collaboration with Hayat program, which is the National Organ Donation Program, we've conducted more than 6 workshops for the healthcare professionals since the year 2023, December, until now. We were targeting mainly the ICU doctors and the ICU nurses, because basically the main donation will come from that area, the critical care area. So, and the emergency department physicians as well. So we are aiming at educating our staff first. We are doing, all these workshops, which will be continued the coming years as well. And on the other hand, we are working hand in hand with the national program, which is a Hayat program, to educate our staff as well as the society.
I believe I interviewed one of the doctors in Robotic. They basically said that with the expats and the locals, they're really receiving the information very well. What's your opinion on that in terms of them receiving these programs quite well?
As we are now here today with you, with the help of the media, I'm telling you, even my own patients, they are coming to me and saying that we heard about this in the media. So can you just give me more information about it? Or can I be a part of the Hayat program and donate my organs? So really, we noticed, especially after the year 2020, that the jump in the donation rate was really remarkable. And I guess it's a framework, the effort of more than one hand, the media, the health professionals, Even let me tell you about one of the ways we are educating our people. There are the families which were donors. I mean, they donated the organs of their own relatives.
Can you highlight the groundbreaking research or innovative technologies being presented at the conference?
While being part of the conference, and I'm running the transplant track in this conference, we just had a session about the advances in the transplant medicine. And one of the advances which our great speakers spoke about is the robotic surgeries to the transplant surgeries. I mean, it's really amazing how well they are using the artificial intelligence in the transplant surgeries. Another thing which I was surprised and I was really impressed, rather than surprised, it's more of like, impressed about the perfusions machines. Nowadays, they have machines which they can pump the organ, the heart, lung, the kidneys, so that they can stay longer outside the body.
Oh, that's fantastic. Yeah. What do you see for the future for the conference at how you use both for the next?
Well, in terms of the conference this year, compared to the last year, honestly, I can see more contribution from the Gulf area. A lot of attendees are from the Gulf area, and I guess one of our aims is to target the Middle East area and to attract them to this conference. This will help us not only to exchange information, but also it will help us to have some collaboration with, remarkable Middle East healthcare bodies.
And last but not least, but what is your takeaway, especially for somebody who is involved in the conference itself? What was your biggest takeaway of this weekend? I know it's not finished, but have one more day.
Well, what I noticed during this conference is that we are having, even in our country, a lot of speakers. They are really remarkable speakers with a great, huge experience. People should not underestimate whatever potentials we are having in our country, because really our country is investing a lot on the healthcare. And really, in this conference, I can see that very obvious.
Thank you so much.
Thank you, dear.
It's active Vast, and thank you so much you just for the preparation of the event. It was a pleasure being here.
Thank you so much.
Or to the next one.
Thank you. Night.